This video is going to be focusing on the biological treatments for OCD, and we're going to be looking at the evaluation points, the strengths, the limitations, the studies that show whether drugs are an effective treatment or not for OCD. Whether it be for OCD or treating any medical disorder, there are always issues with taking drugs. There are strengths, there are limitations. And with SSRIs in particular, there are an awful lot of side effects. You can get indigestion, headaches, vomiting, insomnia, erection dysfunction, aggression, hallucinations, and a lot of the more severe ones here are related to tricyclics, those first antidepressants that we use to treat OCD. But side effects are a big limitation of taking drugs for OCD. However, they are cost effective, especially when we make comparisons to psychological therapies. Psychological therapies and treatments could take 2 sessions a week for many years, each session costing £100. Drugs, on the other hand, are exceptionally cheap in comparison. You pay a small amount of money and you get the symptoms relieved. They're not disruptive. That's another strength of drugs. They don't take up much time. If you're doing a psychological therapy, you might have to spend 2 hours a week of your life in a session. You've also got to travel to that session. And it can take an awful lot of time. Whereas drugs, on the other hand, you're just popping a pill. It's very non-disruptive to somebody's life. And people like that. That's a major strength of why people take drugs in comparison to psychological therapies. However, one of the limitations is that they only treat the symptoms. Drugs will only increase the levels of serotonin, for example, and stop you feeling anxious. It won't deal with the actual cause of your OCD. Psychological treatments will, but drug treatments only treat the symptoms. They don't treat the cause of the problem. That means it's only a short-term relief. If you stop taking the drugs, the problem's still going to be there. And that's why a major limitation of taking drugs. But also, a lot of the evidence that we have is unreliable. Drugs companies sponsor a lot of these studies, and that's why you've got to be very wary when you're looking at studies into drugs, because if a drug company is sponsoring it, it's highly likely that the evidence is going to be a little bit unreliable, because people conducting the study are being funded by the people who are trying to sell the drug. So there are strengths, there are limitations of taking drugs, and if you know these main issues, then no matter what you're studying or what you're writing about for drugs treatments, you can bring these answers into that. One of the most famous studies done on the use of drugs for OCD treatment is conducted by Soomro in 2009. He did a meta-analysis, so he got the results from 17 different studies. And what he found was that SSRIs were more effective than placebos when they were measured using the Y-box scale. Okay, and the Y-box scale is a semi-structured interview. It's the most reliable and valid way of measuring OCD. And a therapist would conduct a semi-structured interview with a patient. They measure their obsessions, their compulsions, and they'd get a score. And that score would determine how severe their OCD was. And it was found that SSRIs were much better than placebos in reducing someone's score on the Y-box scale. However, there was an issue here. It only looked at the effectiveness in the short term. So it only looked at people on SSRIs for 3 months. And this is a major limitation because it doesn't tell us whether SSRIs are effective in the long term. So although it says, yep, SSRIs are good, they're better than placebos in the short term, it means we don't know the long-term benefits. Does it work in any time period longer than 3 months? And this means further studies have to be conducted. If we want to know this, then we need to do more research before we can establish the long-term benefits of SSRIs. There are also an awful lot of alternative explanations about what might cause OCD. And alternative explanations can always be used as an evaluation point in any of your answers in any of your essays. So if we look at the social learning theory, the social learning theory is all that we learn from other people. So you might have a small girl who is at home a lot and watches her mother. Her mother's got OCD and is always cleaning. And as a result of that, the child learns to imitate this behaviour. She copies the mother. Every time she does, the mother gives her praise, says, "Well done, good girl, keep going, you're doing a brilliant job." And as a result of this, the girl will develop OCD. She learns from the mother, she's rewarded, it becomes part of her natural behaviour. So there are alternative explanations. Maybe biological explanation is a reason. Perhaps other people develop it through social learning. So you need to be aware that alternative explanations can be used as an evaluation point in any of your essays, in any of your answers that you write. One of the major limitations of any drug treatment, especially that for OCD, is that the results of studies usually state there's been an improvement rather than a cessation or complete stopping of OCD symptoms. And people are obviously going to be less occupied with the OCD and less severe symptoms, but it's still there in the background. There might be an improvement. Their Y-box score might go down slightly, but their OCD is still present. And that's one of the major issues with drugs and drugs treatments, that it doesn't completely remove OCD. However, it does allow someone to probably get on with their life in a more normal way. It allows them to lead a normal life. It allows them to get on with daily tasks that they may not have otherwise been able to do. And that's probably enough for some people. Some people might be completely happy with that just leading a normal life, being able to have it in the background, but being able to cope with it is enough. But a limitation, on the other hand, is that drugs treatments very rarely cause a complete stop to OCD. A quick recap then on all the points that you'd want to be getting into your answer or into an essay. There are issues with drugs, whether it be cost effectiveness, disruption, the side effects. If you know those issues, then you can use that for any answer on any topic for drugs treatments. There are studies to support it. We looked at Soomro's meta-analysis. It shows that SSRIs are more effective than placebos. Remember, always try and include alternative explanations into your answer. Social learning theory gives a good explanation for why some people might develop OCD. And also, the results of treatments. Treatments for drugs and OCD never state that they completely stop the severity of someone's symptoms. It only reduces it. And that's probably a major limitation. But like we said, sometimes that's enough for people. And if you can lead a normal life, maybe that's the best we can hope for.